Welcome to The Explainer. Today, we are diving deep into healthcare delivery systems. This is one of those topics you absolutely have to know, not just for your exams, but for your entire nursing career. So let's break it down and make it all make sense. So here's our roadmap for today. We're going to start with the absolute basics, the building blocks of the system. Then we'll follow to money, which is always important. After that, we'll walk through the different levels of care, figure out your specific role in this whole thing, nail down the QSEN competencies, and then we'll wrap it all up with some real NCLEX-style prep. All right, first up, let's get our heads around the components of healthcare. To really understand the system, you've got to know the three big pieces: who's involved, where it all happens, and which agencies are making the rules. So what is a healthcare delivery system, really? Well, it's not just a hospital or a clinic. Think of it more like a giant, complex web. It's all the interactions between us, the providers, and our clients, but it's all shaped and, frankly, limited by how it's paid for and the rules we have to follow. Now, at the very center of this web, you've got three groups of people. Of course, you have the consumers, our clients. Then there are the licensed providers, that's us, the RNs, the APNs, the doctors, and you can't forget the unlicensed providers, the assistive personnel who are so critical to making the team work. And where does all this happen? Literally everywhere. It's so much more than just the four walls of a hospital. You could be delivering care in a patient's own home, at a school, a community clinic, you name it. The possibilities for you as a nurse are just massive. And finally, you have the rule makers. Think of these agencies as the referees in the game. They're the ones setting the standards to make sure care is safe and effective. You've got the FDA looking at drugs, the Joint Commission accrediting hospitals. They all play a huge part. Okay, let's pause for a quick NCLEX checkpoint. You're going to see questions just like this, so take a look. When you think of a state licensing board, what is their number one job? What do they focus on? And the answer is B. This is so important to get right. The Joint Commission sets those big accreditation standards for the whole hospital, and the FDA handles med safety. But the state licensing board? Their job is to look at you, the individual provider, and make sure you are following the specific rules for your state. It's all about individual compliance. All right, we've got the who, what, and where down. So now, let's follow the money. Seriously, understanding how all of this is paid for is absolutely critical because it really dictates who gets what kind of care and where they can get it. So, if you zoom way out, you can basically split financing into two big buckets. On one side, you have publicly funded programs, think Medicare and Medicaid, which are run by the government for specific groups of people. And on the other side, you have all the privately funded plans, like the PPOs and EPOs a lot of people get through their jobs. And listen, for the NCLEX, you absolutely, positively have to know the parts of Medicare. Just remember this. Part A is for the hospital. Part B is for your doctor visits, outpatient stuff. Part C is the Advantage plan that kind of bundles it all together. And Part D is for drugs. Just say it over and over. A for hospital, B for doctor, C for combo, D for drugs. Okay, so we know who's involved, where they are, and how it gets paid for. Now let's organize the kind of care they get. This is super helpful because these 6 levels give you a framework for a patient's entire journey through the healthcare system. I love this slide because it's like a map. See, we start with preventative care. That's things like vaccines and health education. Then you move to primary care, like your annual checkup. If you get sick with something acute, like the flu, you're in secondary care. Tertiary care, that's the super specialized stuff, like an ICU or a transplant unit. Then restorative care is all about getting you back on your feet, like in a rehab facility. And finally, continuing care is for long-term needs, like what you'd see in hospice. So let's put this into practice. A nurse manager is trying to tackle obesity in their community. Take a look at these options. Which one of these fits perfectly into that primary care bucket of health promotion and disease control? Yep, the answer is A. Screenings are the perfect example of primary care. We're trying to catch things early and keep people healthy. Those specialized beds, that's more like restorative care. And surgical training for bariatric surgery, that's highly specialized, so it falls under tertiary care. See how it all fits? Okay, this next part is so important. This is where we take all of these big systemic ideas and connect them directly to what you do every single day as a nurse. We're going to talk about your role and the social factors that can make or break your patient's health. You just can't treat a disease without treating the person and their whole life situation. These are the social determinants of health. You have to ask, does my patient have a safe home? Can they afford healthy food? Do they have a job? Do they have support? I'm telling you, these factors can have an even bigger impact on their health than any medicine we can prescribe. So what is your job in all of this? Well, it is huge. You are an advocate. You're the one assessing for these social risks. You connect people to resources. And you know what? You even have a role in shaping policy to make our communities healthier. Your job is so much bigger than just the tasks you do at the bedside. All right, let's talk about something you are going to hear about constantly, from your very first day of nursing school till the day you hang up your stethoscope, QSEN. It stands for Quality and Safety Education for Nurses, and it's basically the foundation for providing safe, top-notch care. First up, and most importantly, is patient-centered care. The big idea here is that the patient is a full partner in their own care. Their needs, their values, they guide everything we do. It means if a patient makes an informed decision we might not agree with, we respect it. It's their life, their choice. Next up, teamwork and collaboration. Because let's be real, none of us can do this job alone. It takes a village, right? We have to work seamlessly with doctors, pharmacists, therapists, social workers, everyone. This is what those daily team huddles are all about, making sure we're all on the same page for the good of the patient. Competency number 3 is a big one, evidence-based practice. EBP means we don't do things just because that's the way we've always done it. No way. It means we are constantly looking at the latest research and using that credible knowledge to guide how we care for our patients. It's about being a lifelong learner. Quality improvement, or QI, is all about being a problem solver. It's about using data to look at our processes and constantly asking, how can we do this better? How can we make things safer? So if you notice a spike in patient falls on your unit, a QI project would help you figure out why and test new ways to prevent them. Safety is the absolute bedrock of everything we do. It's about minimizing the risk of harm to everybody. And it's not just about being careful yourself. It's about building better systems. Think about barcode medication scanning. That system is there to back you up and help prevent a mistake. It's about building a culture of safety. And finally, we have informatics. This is all about using technology to be a better, smarter nurse. We're talking about using the electronic health record to manage knowledge, to communicate with the team, and to support our clinical decision-making. It's about making technology work for us and our patients. All right, let's bring it all home. We're going to wrap up with a fantastic memory tool for QSEN that you're going to want to write down, and then we'll take all of these ideas we've talked about and apply them to a real-world scenario. This is where the rubber meets the road. Okay, get ready to tattoo this on your brain for the NCLEX. To remember the 6 QSEN competencies, just remember this sentence. Safety training prepares quality-informed nurses. See? Safety, teamwork, patient-centered, quality improvement, informatics, and EBP for evidence-based practice. You got this. Lock it in. Okay, time to think like a nurse. Here's your patient. You see what's happening here, right? The medical diagnosis, diabetes, is all tangled up with those social determinants of health we just talked about. No way to get to the clinic, an unsafe neighborhood, no job. This is what nursing looks like in the real world. So here it is, your clinical judgment moment. What do you do next? What is the priority here? To make sure this patient gets the care they desperately need, which of these barriers do you need to tackle first? Think about your role, think about the resources, and think about what poses the most immediate threat to their health. This is where it all comes together.